In health news this morning, the latest data from the CDC shows C-sections are going up.
In 2022, there were more than 1.1 million C-section deliveries. That's 32% of all births in the United States. As Christine Pei reports, doctors say that number is concerning.
Chances are you know someone who's been born via cesarean section, or maybe you are a C-section baby yourself. The latest data from the CDC shows C-sections are going up. In 2022, there were more than 1.1 million C-section deliveries. That's 32% of all births in the U.S. In Washington state, the C-section birth rate is slightly lower at 29.7%. Specialists at Overlake Medical Center call these figures concerning.
1 in 3 patients is going to have a cesarean birth.
Margie Bridges is a perinatal clinical nurse specialist at Overlake, where they see an average of 10 births a day.
There are so many variables that go into having a C-section, and some of them are really legitimate, right? So if a baby is not positioned properly, if a placenta is not positioned properly, if labor is not progressing despite all of our things that we know to help labor progress.
The current 30% average is far higher than the preferred WHO target of 10 to 15%.
What we're seeing a little bit more of is just people choosing to have a cesarean section in the absence of any medical reason.
And the reasons are multifaceted. Bridges says some women might find it convenient to schedule their delivery.
But there can be things also like fear of labor, fear of, not knowing what to expect, that uncertainty.
Bridges reassures that withstanding complications, natural birth is safe with many benefits, including faster recovery for the mom and for the baby, better breathing capabilities upon birth due to their lungs being cleared of fluid during the labor process. And during natural birth, the baby is exposed to beneficial bacteria to support the immune system and microbiome.
So we don't want a decision to be made out of fear or feeling unprepared. We really want it to be based on the evidence. And so it would be a discussion. And in most cases, a vaginal birth is preferred in the absence of a medical condition. It really is.
For HealthLink, I'm Christine Pei reporting.